Hello everyone, happy morning, a very good morning. I hope and I believe all of you are doing well. Am I audible and visible, everyone? Okay, that's great, guys. So here we are into this session, which is VBQs, the video-based questions in radiology. Now, I know that many of you might be worried about, what video-based questions we will get in the exam, because we have seen few video-based questions. Am I back? Am I audible and visible? Yes, I mean, that was the very reason that we had the delay in the class as well. There is some technical glitch that we are facing, right, with my laptop system, but I hope, we'll be able to complete this session. Okay, so now if you are worried about the video-based questions, that would be asked in the exam, because there were quite a few questions that were asked in the recent FMG exam. Videos, remember, are going to be like simpler than the images, because you have the complete loop which is there, and they're nothing but the image-based questions. So if you're prepared for the image as well, even videos would be easy, right? So that is why in this particular session, I've not included the videos which are just like, images easy from there. I've tried to include the VBQs, the video-based questions, which are exclusive and which you might have not otherwise seen, when you were preparing for IBQs, because the detailed images revision we shall have in the LRR session, which is going to happen on 15th of August at 1 p.m. So today's session is dedicated on VBQs. And at the end, I'm also going to tell you that what other video-based questions, apart from what we are discussing in this session, can you expect in your final exam as well. Okay. ठीक है FMG VBQs, maybe I'll share with you on Telegram. So there were also like PSM में logos के 4 images डाल दिए थे, and you were asked to arrange in the sequence. So even like 4 images can be converted into one video. Same thing can happen with radiology science as well. There can be 4 signs labeled 1, 2, 3, 4, and you would be asked, उसको arrange करो. All right. Okay. So let's start with this one, guys. This is the first VBQ that I have for you. You can definitely get images like this. Identify the procedure, right? The investigation that is being done here. Yes? Very good. So this is a barium swallow. As you can see here, remember barium swallow or any fluoroscopy video, you can have the contrast which appears white or the contrast which can appear black as well. So here you see this black which is coming. That is going to be, so the patient is swallowing here barium, and then the barium you can see is going down. So this black colored here is actually the barium, because you can also see the vertebra, right, which normally look white on X-ray. They are appearing black here. So what is dense here is appearing black. So this is from the mouth. It is going into the hypopharynx, the esophagus. So this is going to be what procedure? What investigation? This is going to be barium swallow. Okay, this is a normal barium swallow that we are seeing here. So let me show you another video here. What are you seeing in this video? Yes? There was no filling defect in the previous barium swallow. That was a normal one. What are you seeing here? Absolutely right. So now you can see that the barium which you are seeing here, the barium is going into this outpouch like thing, the diverticulum which is there, directed posteriorly, and there is hold up of barium which is happening there. So this is the Zenker's diverticulum, the upper esophagus diverticulum directed posteriorly. That is the Zenker's diverticulum. Remember, in image-based questions or video-based questions, the clinical history that will be given will be a major clue to answer the question, even if you're not able to, identify the image or the video. So classical history that you would have in Zenker's is an elderly male patient, with triad of, what are the symptoms there? It is dysphagia, which is there, dysphagia, halitosis, and regurgitation, right? Dysphagia, halitosis, regurgitation. The best investigation is barium swallow, not endoscopy, because it can perforate, right? And you have Dolman surgery. Remember, Dolman is done in an old man with Zenker's. So Dolman surgery is what we have here. Correct. It's a pulsion diverticulum, false diverticulum. Absolutely right. Killian's dehiscence से आता है posterior directed diverticulum. Okay. Going to the next one. Identify this procedure now. What do you think is this procedure? I'm not giving you any options. Let's see if you're able to identify this without any background history or without any options. You want me to zoom in? I'll zoom this. Anyone? What do you think is this? Okay. Some of you say it is RGU, it is ERCP, it is MRCP. Okay, why do you think? So you guys are close at least. This is something related to the bile duct. This is not RGU or this is not HSD. And this is not even ERCP or MRCP. I have not got the correct answer yet. Okay, so let's have a look at this one. Now look at the image carefully, identify in the background. Can you see this vertebrae in the background? Right, there are those vertebrae in the background. And if you see carefully there, these ones, the bones that you are seeing here, those are the ribs there. Okay, those are the ribs that you are seeing there, right? So remember, we are here in the hypochondriac region. We are not lower down in the pelvis to say that this is RGU or HSD. And what you are seeing here, this is a tube-like thing which is coming, right? The video is moving, so it's difficult for me. जो ट्यूब जा रहा है ऐसे CBD में जा रहा है and that's a T tube there that you are seeing. Endoscope will come from above when you're saying it's ERCP. So the ERCP, the endoscope comes from above, esophagus, stomach, duodenum से आता है, right? This you are seeing here is coming from outside, right? And it is going into the CBD like a T tube. So this is T tube cholangiogram. Right, this is T tube cholangiogram post-operative जो करते हैं. This is not ERCP, guys. Okay, this is not ERCP. The contrast in the T tube is making the T tube appear white. And if you see here, there is this dilatation of the hepatic duct. There is some narrowing in the CBD here. And post that, there is some dilatation. Okay, give me a minute. Right, and you see some dilatation in the CBD beyond the T tube point as well, right? So this is, you just have to identify the procedure here, the identification of the procedure here. This is T tube cholangiogram. This is not ERCP. Is this clear with everyone? Okay, triple phase is something, Satyam, that you do on CT. Triple phase CT for liver lesions, right? So वो CT MRI में आएगा, यहाँ पे नहीं आएगा. This is X-ray with contrast. It's a fluoroscopy image, that is T tube cholangiogram. Okay, going to the next one. First, identify this modality. What is this? What is this here? Correct. This is a USD. And can you identify this structure, this organ in the abdomen? What is that on USD? No, there's no shadowing here. What is this organ on ultrasound? That's not the gallbladder. Think logically. If it would have been gallbladder containing bile, fluid, that appears black on ultrasound. This is not appearing black, right? It has this solid structure wala ecogenicity, gray color. And this white in the center that you are seeing is the fat. Fat is white on ultrasound. Remember, it's hyperechoic. So that is the sinus fat, the central fat in the kidney, and all that surrounding that, that is the renal parenchyma that you are seeing. So what you are seeing here, this is the kidney, right? Liver coming here, hepatorenal pouch. What are you seeing? What is present here in this hepatorenal pouch? What is that? The black color on ultrasound is fluid. Okay, so there is this presence of fluid. So previously there has been fast image ka image based question. Now you can get a video based question with the ultrasound clip. So is it fast positive or is it fast negative? What is this? This is fast positive. the fluid is present, right? This is fast positive, telling you that from somewhere the bleeding is occurring in this patient of trauma. If the patient is unstable, you'll go for surgery directly. If the patient is stable, then you will go for further detailed evaluation to see from where the bleeding is coming by doing CT. Okay, so this is fluid present. Absolutely right. This is the presence of fluid. Remember, fluid is black on ultrasound. This is fast positive, a video that can come in the exam. Going to the next one. Identify this modality, right? And what structure, what organ are you seeing here? What is it? Correct. So all of you have identified correctly ki yes, this is the heart. You can see the heart beating there, right? The heart beating. So this is the heart that you are seeing. And what modality is this? This is not an echo. This is not ultrasound. This is not a CT as well. What is this? Basically, this is cardiac MRI. Okay, this is cardiac MRI. If you see very carefully, this is the area where you have the vertebra present, right? पीछे यहाँ पे spinal cord surrounding CSF है. So this what you are seeing here is the vertebra, the bone which is black, right? And this is cardiac MRI. Okay, this is cardiac MRI. This is not cardiac ultrasound. That is echo or not even CT. The bone is not white. Okay? And if I ask you to identify this chamber, the arrow is here. Identify this chamber on cardiac MRI. What are these? So no, that's why I'm preparing you for the worst. Mostly exam में जो questions आएंगे वो easy आएंगे, right? So we are preparing for the worst, guys. Very good. This is the left atrium. You know that it's the posterior most chamber of the heart. When you come from the vertebra, posterior most chamber of the heart, that is the left atrium. You can see this pulmonary vein draining into the left atrium. This is the left ventricle, which has this more thick muscle wall as compared to the right ventricle. Right ventricle is anterior most. This is right ventricle, right atrium, left ventricle. And what are you seeing here? Aorta ke baaju mein, left atrium ke yahan, that is vertebra ke baaju mein, that's the aorta there. Okay, so this is cardiac MRI. Okay, this is cardiac MRI that you are seeing here. Okay, similar image you would have prepared, you know, image based question to aapne prepare kiya hoga. It can come as a video also. Going to next one. Now identify this modality now, and what are you seeing here? Okay, now this is what is ultrasound, right? I hope you are able to differentiate it now. This is ultrasound of the heart, right? The heart beating that you are seeing. This is the heart here with the 4 chambers. Okay, there are these 2 atria and 2 ventricle that you are seeing here. यहाँ पे aorta है, ये left atrium होगा, left atrium उसके आगे left ventricle, right atrium उसके यहाँ पे आगे is right ventricle. So these are the 2 ventricles. These are the 2 atria that you are seeing here. If that is the case, can you tell me what valve are you seeing here? What is this valve going to be? The one where I put an arrow. What is that? What valve will come there? Very good, because it's present between the left atrium and the left ventricle. That's going to be the mitral valve there. And what will come here will be the tricuspid valve, right? So if you're able to identify the chambers, you'll be able to identify the valves. This is the 4-chamber view of the heart where you are seeing the mitral valve and the tricuspid valve. And also remember, there is something called as, you know, when we do echo, even fetal echo bhi jab karte hain, there's something called as moderator band. Okay, there is this moderator band which is present, which helps you identify that this is the right ventricle. So remember that moderator band is present in right ventricle. Okay, moderator band, this line like thing that you are seeing going towards the septum, that is moderator band, tells you this is right ventricle, right atrium, left ventricle. So this is mitral valve and this is tricuspid valve. Okay, and you can see in the left atrium the pulmonary veins opening, and behind the left atrium you have the aorta there. Okay, all right, let's go to the next image. Now you are seeing the same heart ka ultrasound here. Is there something abnormal here that you are seeing? Is there something abnormal here surrounding the heart? Very good. Right. The dancing heart, the floating heart, because of this black color surrounding the heart, the black color is the fluid, right? So this is, you are seeing the fluid, black fluid surrounding the heart, pericardial effusion, tamponade, pericardial effusion. You can see this right ventricle wall also showing some bending, some collapse which is happening. So there is this collapse of the right ventricle wall happening. The heart is dancing in the fluid. This is cardiac tamponade, pericardial effusion, cardiac tamponade. Black is the fluid. Right? Is this clear with everyone? So this is how you will identify. Once you know that fluid is black on ultrasound. So this is pericardial effusion or tamponade. Okay? Clear with everyone? And what do you see in ECG? What do you see in ECG with tamponade or pericardial effusion? Remember, because of the fluid, the heart is floating. Sometimes it is coming aage, sometimes it is going piche. So you have electrical alternance, right? The amplitude of the waves is changing. It is electrical alternance, not pulsus alternance. Where do you see pulsus alternance? Pulse, weak, strong pulse, weak, strong pulse. Pulsus alternans is seen in left ventricular failure, right? And what do you see in cardiac tamponade is the Beck's triad, right? Remember the Beck's triad? You have the vein draining into the heart and artery coming from there. So one thing from the triad is from the vein, increased JVP. One from the heart, decreased heart sounds because of the fluid. And one from the artery, that is hypotension. Right? So this is going to be hypotension, raised JVP, muffled heart sounds. How do you differentiate cardiac tamponade from pneumothorax clinically? In cardiac tamponade, the heart sounds are muffled. In pneumothorax, the breath sounds are absent. Okay, that is how you would differentiate. Okay? Is this clear with everyone? Right. So that was cardiac tamponade. Going to the next one. Okay, without telling you any background history, any options, can anybody identify what are you seeing on this ultrasound image now? The only clue I can give you, this is ultrasound, abdomen. हम abdomen में कर रहे हैं. What are you seeing here? Very good. Somebody has identified it पहले तो ठीक है. This is kidney और क्या दिख रहा है? Very good. This is kidney that you are seeing here. So this organ that you are seeing here, this is the kidney. The white, that was the fat that I had shown you in the fast wala ultrasound image as well. And what is abnormal here? If you see that वो fat के अंदर, can you identify कि यहाँ पे कुछ ऐसा black दिख रहा है? Right, those black areas. So this is basically hydronephrosis. Okay, that is hydronephrosis in the kidney that you are seeing. So this is the renal pelvis, and from there will come the ureter. So you can see hydronephrosis, proximal ureter is also showing dilatation. So what you are seeing on this image is USG with hydronephrosis and proximal hydroureter that you are seeing here. Okay, so that is the fluid, the dilated pelvis and the cholysis. This is hydronephrosis with proximal hydroureter. You will have the background history given in this question. For example, the patient has loin to groin pain. So what are you seeing? Hydronephrosis, obstructing calculus. Is this clear with everyone? Beaded appearance, this is just a normal appearance of the kidney that you have there, right? Renal surface का appearance है वो renal cortex का appearance है. Okay, Arjun, how to differentiate angiomyolipoma with versus RCC on CECT? Angiomyolipoma, lipoma means it will have the fat content which is going to be present, the dirty black appearance. RCC does not have fat. It is solid and it can have necrosis, but it will not have that fat component there. Okay. नहीं, colon ऐसा नहीं दिखेगा. Colon, because remember it contains air. So when you will do ultrasound for colon, it is filled with air. You will not be able to see the other wall of the colon because the air gives the shadowing on ultrasound, right? So the air obstructs visualization of the structures distal to it beyond it. So आपको ऐसा पूरी border नहीं दिखने वाली है ना colon में. Until and unless it is filled with fluid, bowel loops filled with fluid, you will be able to see them anterior wall, posterior wall completely. Otherwise, if it is air filled, you will not be able to see on ultrasound. ठीक है? All right, going to the next video based question. Okay, so if I tell you, this is ultrasound of the uterus, that's a clue that I can give you. So what are you seeing here? Black color and a doctor self-improver, so that's why it is fluid hydronephrosis. If there would have been white color with the shadowing, then you will say that there's a stone. Very good. This is molar pregnancy, snowstorm appearance, the cystic spaces that you are seeing. This is not adenomyosis, because all this cystic spaces that you are seeing is in the echogenic endometrium. This is not in the myometrium. Adenomyosis is endometrium going into the myometrium. This is the distended endometrial cavity with the cystic spaces there. Absolutely right. So this is the snowstorm appearance of molar pregnancy. Complete mole snowstorm appearance, right? You will see the cystic spaces. There will be no fetal parts present. Okay? What can you see in ovaries with molar pregnancy? What will you see in the ovaries with molar pregnancy? The elevated beta-HCG level in molar pregnancy stimulate the ovarian follicles, and it can lead to the cyst, that is theca lutein cyst will be present in ovary. Okay, theca lutein cyst is what will be present in ovary. Absolutely right. So for any gestational age molar pregnancy, we need suction evacuation. Once you do suction evacuation, the beta-HCG goes down. The theca lutein cyst also in the majority of the cases regresses spontaneously. Okay. Right, they resolve on its own after the suction evacuation. So this is an example, you've seen the image already for molar pregnancy, and this is how a video would look like, right? It's not going to be difficult. Next one, very, very easy. You can have straightforward, easy video-based questions also like this. What is the investigation? What modality, what investigation is this? Very good. This is Doppler, right? Can you see that? This is the vessel here, and you can see this color in that vessel, right? So that is the Doppler. Also appreciate that on the color scale, which is there, centimeter per second is written, telling you that centimeter per second is the blood flow velocity, is what the color, based on the color grade, you can identify the blood flow velocity. Okay. Now, instead of centimeter per second, if there would have been kPa written here, then what modality would have that be? आपको कलर दिख रहा है अल्ट्रासाउंड में, रेड, ग्रीन, ब्लू, येलो, वो सब कलर दिख रहा है, बट स्केल पे kPa लिखा है, किलो पास्कल्स, इंस्टेड ऑफ द सेंटीमीटर पर सेकेंड. देन व्हाट इज दैट गोइंग टू बी? Yes. What modality is that going to be then? Very good. That's going to be like fibroscan wala, which is basically elastography. USD elastography will have that strain wala unit, which is kilopascals, and Doppler will have the blood flow velocity wala measurement, which is centimeters per second. And look at the color change. There are two vessels which you can see here. One is showing red color, one is showing blue color, the other one. What does the color indicate in color Doppler? What does the color indicate in color Doppler? So this modality, this investigation here is color Doppler. What does the color indicate? It indicates the direction of the blood flow, right? It indicates the direction of the blood flow. Is it towards the transducer or away from the transducer? Okay. So remember, it is red color and blue color. Red tower, that is how you remember. Red tower blows away. Okay, red tower blows away. So red is towards, blows is blue, is away. Red is towards the probe and blue is away. It indicates the direction of the flow as compared to the probe. Okay, right? Going to the next one. This is again an ultrasound image, right? If I give you the history, this becomes like easy to identify. The clue that I can give you is this is ultrasound is being done, right, for peripheral vessel. What are you seeing here? right? So there are these two vessels that you are seeing here. There is artery and a vein. So what is that indicating? No. Very good. Some of you have identified Pearl, Prajapati, Rahul, absolutely right. Som Subra. There is DVT which is there. Can you appreciate that there is some pressure जैसा thing आपको दिख रहा है कि ये हम press करने की कोशिश कर रहे हैं. You can see that vessel getting pressed. This vein is not getting compressed. Normally the vein should get compressed. It is not getting compressed because there is something inside, sitting inside that vein, which is a thrombus. You can appreciate this. थोड़ा echogenic जैसा भी दिख रहा है thrombus. So this is the vein which is non-compressible, very, very important. Remember, a non-compressible vein is suggestive of DVT. Normal vein क्या होता है? Right, thin wall, low pressure, you compress with the probe, it gets compressed. So compressible vein is normal. If the vein is non-compressible, distended with thrombus, it is going to be DVT. You will have the background history of calf pain, edema, recent immobilization, like recent surgery, long flight journey, right? All these are the common clues given in the question with calf pain and edema. This is going to be basically DVT, right? Okay. Next one. First, let's have a look at just this image. Can somebody identify this investigation, this modality here? What is it? Very good. Amazing, guys. This is the eye scan, this black and white ultrasound of the eye. This is called as B scan, not the A scan. A scan is something which you see like a graph, right, which helps you measure the axial length of the eyeball. This is the black and white ultrasound image. This is the B scan, right? This is the B scan of the eye. Okay, this is ocular ultrasound, B scan of the eye, which helps you see this posterior segment well. Right, you will be able to see the posterior segment of the eye, which is the vitreous. यहाँ पे आएगा retina, उसके आगे आएगी vitreous की layer. This black that you see here, this area, this is where the optic nerve attaches, optic nerve head which attaches there. ठीक है? So remember, this is normal B scan. Okay, this is the normal B scan that you are seeing here. Do I have? Okay. Now look at this video for the B scan. What are you seeing there? Can you appreciate that in this black fluid, that's the vitreous there. There is some membrane-like thing which is floating there. There is some membrane-like thing which is floating there. है ना, ये आई ग्लोब का मूवमेंट भी हो रहा है, आई का मूवमेंट दिख रहा है, और द पेशेंट इज डूइंग आई मूवमेंट एंड दिस मेम्ब्रेन इज मूविंग विद द आई मूवमेंट. इट इज नॉट अटैच्ड हियर posteriorly at the optic nerve head. It is floating and moving with the eye movement. So this is going to be vitreous detachment or retinal detachment. This is vitreous detachment. This is not retinal detachment, right? Because it is freely floating. It is moving with the eyeball. There is no posterior point of attachment. If it would have been retinal detachment, you have the optic nerve head here. The retina is attached at the optic nerve head point. Then it is going to be retinal detachment. Okay. So more thinner membrane is going to be vitreous. Retina is going to be more thicker and attached posteriorly. Okay? Yes, it will have some point of attachment in the retina. Look at another B scan ka video. What are you seeing here? This rotation movement is basically, the patient doing the eyeball ka movement. And what are you seeing there? Where do you put the probe when you're doing B scan? You ask the patient to close the eye. You put the gel on the ultrasound probe, right? The linear one, which is high frequency, and you put that probe on the eye, right? Eyelid के ऊपर रखते हैं. Fish inside the eye, right? You see like that tumbling, जैसा the rotatory movement which is there. There is something echogenic inside the black vitreous which is rotating like the washing machine जैसा movement हो रहा है. वॉशिंग मशीन में जैसे मूवमेंट होता है. There is something echogenic which is there in the vitreous. Remember, echogenic here on ultrasound is blood, right? So what is the diagnosis here? This is vitreous hemorrhage. Okay, so if they tell you ki vitreous mein there is something echogenic, right? Remember, we are talking about vitreous hemorrhage. Okay, that is vitreous hemorrhage that is there. Absolutely right. Blood hai. Echogenic is going to be blood. Right? Clear with everyone? Okay. So, those were the quick video-based questions that I had for you guys for today. The other potential video-based questions that you have in radiology, angiography, DSA image can definitely come with, the aneurysm being there on DSA that can be shown. You can also have the CT MRI scrolling images with arrow put on some structure or some sign. So not only ultrasound, even CT and MRI can come as, how we see in the radiology department. Scrolling images can come with the arrow put there. In the FMGE exam, the video player which was there, it had the pause button, it had the option of increasing the speed as well. So wherever you see that arrow, you can put a pause there and you can see, what it is pointing to. And like I mentioned in the beginning, there can be 4 science images which can be clubbed together as a video labeled as 1, 2, 3, 4, and they will ask you what is sign number 2, or they'll ask you to arrange from 1 to 4 what signs are these, similar to the logo images that had come in the recent FMG exam. 4 logos were given as video and you were asked to arrange ki what are these logos representing. ठीक है? थैंक यू सो मच. मैंने डेलिबरेटली थोड़े से आउट ऑफ द बॉक्स वीडियोस डाले हैं, बट टू प्रिपेयर यू फॉर द वर्स्ट. But FMG में जो videos थे, you ask the FMG aspirants, they would say that the video-based questions were easy, and hopefully the same is going to be for NEET PG. But it's always better to prepare for the worst, and that's why we had these questions with these images being discussed. Dhruv, that's just basic in the USD probe, right? You have a convex probe, you have a linear probe. Convex is a low frequency, linear is a high frequency. In ultrasound, the probe which has lower frequency, it has better penetration. So it is used for deeper structures like abdomen, obstetric ultrasound. The higher frequency linear probe, it is going to have a lesser penetration but more resolution. And it is used for superficial structures like thyroid, breast, scrotum, or ocular B-scan करना है. Superficial के लिए हम करते हैं. Right? इतना basic सिर्फ पता होना चाहिए. देखो डिफिकल्ट आएगा भी तो ऐसा डिफिकल्ट आएगा तो सबके लिए डिफिकल्ट होगा, सिर्फ आपके लिए डिफिकल्ट नहीं होगा, है ना? So whatever is going to be the case, it's going to be for everyone, not just for you. But at least let's be, positive about this. कि इसमें से कोई आया, we will be able to answer it in the exam, right? If we have seen those videos, right? Thank you so much, World of Animals. You don't have to locate, right? You'll be given the right hypochondrium, the left hypochondrium. When you are doing E-fast, right, you just have to know whether to see, how to identify whether the fluid is present or not present when you are doing the fast. Okay? All right. Thank you so much, everyone, for joining in. I'll see you again on 15th of August. 1 p.m. with the LRR radiology session, a quick review of all the important images and the potential questions in radiology for your upcoming NEET PG exam. Till then, goodbye, take care.